40% of women over the age of 30 have uterine fibroids, but just a fraction of women know that they have them, especially because those symptoms could be explained away by changes you think your body goes through as you age. Joining me is Meriter nurse practitioner Marta Staple. Marta, thank you so much for joining us on the morning show on this.
Thank you for having me.
I had a hysterectomy because it was the end of 4 years of extreme weight gain. I mean, extreme weight gain. I was fatigued. I lost interest in hiking, yoga. I couldn't do the twists. I felt full, and it seemed like nobody was diagnosing me. So how do we let women know that, no, this is not middle-aged?
Well, it's interesting that you bring up that series of symptoms because they're very common and can be caused by a variety of different things. However, fibroids is one of those different things. Fibroids is very common and generally just a benign small growth of the muscle of the body of the uterus. They in themselves are not a problem. They can be as small as 1 centimeter. And cause no issues whatsoever. However, it's the growth over time, primarily in women who are perimenopausal.
And we are looking right now at a picture of a uterus with some of those fibroids. And now, while my case was a little more extreme, they were, the largest was the size of a grapefruit, can they be dangerous?
They can be dangerous if their growth and bulk, the enlarging of them, starts to push on surrounding structures. So you can end up with back pain, constipation, increased urinary frequency.
Oh yeah, and let me tell you, sneezing was never a fun thing.
And that,
ladies, y'all know what I mean.
Women don't really want to talk about that a lot, but
I'll
it's
talk about it.
extremely common.
Yeah.
It's extremely common and very disruptive to the quality of life. Additionally, though, depending on where a fibroid grows in the body of the uterus, even a small one can pull a lot of excess blood flow to the uterus, increasing menstrual blood loss.
Extreme periods, painful periods, every single month. Now, what about the difference between fibroids and endometriosis?
So both of those, and I would add in that mix ovarian cysts, are all benign conditions of the gynecological tract that arise for different reasons, but can all cause a similar set of symptoms: increased pain with the period, discomfort or fullness in the pelvis, pain with intercourse, and they all require inspection.
Okay, so how, as women, we're in our doctor's office, how do we say, look, this is not right? You may give me a pelvic exam and say, you're just fine, but how can I get more reassurance?
Yeah.
How do you diagnose these?
With a pelvic ultrasound. Sure, our hands are really useful tools, and primarily, the source of diagnosis for this, that and a good history. But additionally, if on the exam you're not feeling anything, the next step is a pelvic ultrasound.
Well, can a woman request this, though, with a doctor who's saying, oh, diet and exercise?
Which are super useful. However, I encourage my patients to really advocate for themselves, particularly if they have symptoms that are bothering them. They feel in their gut this is not right.
Advocating is one thing. Can we request that ultrasound?
Absolutely. People
Really?
can certainly request it of me. Then we have a conversation. What are the risks? What are the benefits? What are the alternatives to that therapy?
And an ultrasound just basically is
a low-risk picture taking of the pelvis. Yeah.
So it's what you do to see what a fetus.
Exactly. Exactly. Yep, it gives the best picture of what the ovaries are doing, what the inside of the uterus is doing, and what the body of the uterus is doing. Even the smallest of fibroids can be detected on a pelvic ultrasound, which gives a woman the idea that over time she can expect some growth, and if symptoms of new back pain, pelvic bloating, urinary frequency begin, it gives her that red flag that maybe my fibroids are growing and I can be proactive.
I have to tell you, that surgery, the hysterectomy, changed my life. I mean, when I talk about it, I almost want to cry. It got to the point where I was considering going on antidepressants, and it's, a hard thing to admit being on air, but I had just lost my life, who I was. So I have to tell you, and you should just make sure, talk to your doctor, make sure you push for these answers. Don't just settle for a diet and exercise. Really be proactive.
I couldn't agree more.
Marta, thank you so much. We appreciate your time.
Thank you for having me.
Let's roll the chimes and get to that all-important forecast, Charlie.